So we set up a study to look prospectively at people who had cataract surgery, and we recruited over 2,000 people into this project. They were people recruited at the time their cataract surgery was booked, and they had photographs at that time and immediately one day after the surgery was done, because we knew for some people with cataract you couldn't really see the macula carefully, or you couldn't see the detail of macular degeneration because of the cataract. So we decided that any progression wouldn't be within 24 hours, it would be likely to be much longer, so we made sure that at least as well as the pre-op picture, we got a photograph immediately one day post-operatively, and then progressively over a 5-year period. So it was designed to be a 5-year study. We're now determining whether we could follow these people for longer, up to 10 years, and we're looking at that.
I think that's an important difference between what you're doing and what Susan Breslov was doing. I noticed that she would test them a week after. Surely a week is not long enough to tell significant change.
That's right. So we felt that the population data suggested it was a long-term risk. So we, so far, something like 1,830 people had had their cataract surgery and had been followed for at least 3 years. So we decided to do this interim analysis, not the 5-year analysis, but we still are following people. But the interim analysis showed the data I presented, that in fact there appeared to be, and we also didn't just do it in the group who had some of these people, or many of them had had cataract surgery in both eyes. We decided to do a paired eye comparison to look at the operated versus the non-operated eye as a control for itself. Now, and it's not perfectly valid because we don't exactly know why one eye was operated on versus the other. It could have been, for example, that the eye that was operated on had worse vision and it was contributed to more by macular degeneration signs than the eye that wasn't operated on. So there are always some limitations and concerns, but we have documented this as well as we can, and so far at the 3-year point there was no difference when we did a paired eye comparison of people, the operated versus non-operated eye. There's been no difference in the 3-year progression rates for either progression to late AMD or progression to more advanced early AMD, or so-called dry AMD.
Now, I saw in the cases where one eye was operated, the other eye wasn't operated. Is there a theory to account for the fact that you may get more advanced AMD in the non-operated eye versus the operated eye? Is there some kind of contralateral effect that you're looking at?
Not that we believe, and the idea was
some activation.
The idea was that cataract surgery. The idea when studies found that there was seemed to be a link between cataract surgery and progression was that either more light, particularly blue light, ultraviolet light, might get in the eye after surgery, and we of course know that people are living now and awake with lights on for many hours of the day compared to our ancestors who had the lights off and no sort of bright lights during the nighttime periods. We know that, so the thought was that light load might actually be a problem and be the cause of the progression. But there was also a suggestion that it might be inflammation, although if it was long-term it would be hard to think of why the inflammation would be so protracted. So the light theory was probably the strongest theory.
Right.
There has also been a push, as you would be aware, for physicians to use the blue blocker lenses with a yellow filter in them to try to reduce any excess ultraviolet or blue light exposure to the macula. The macula appears to be particularly sensitive to blue light because it has a yellow pigment sitting in front of it, presumably as a protective factor, and the lens itself, when it develops cataract, develops a yellowing, which will absorb blue light and ultraviolet type light. All of the intraocular lenses previously had an ultraviolet filter, but they didn't necessarily have a blue filter in them. And now most lenses that are implanted actually have a blue, a yellow filter, which will filter out blue light as well.
Right,
So the result of this study was that we really didn't see a difference in the paired eye comparison. So at least to 3 years, there doesn't seem to be a risk. And the study is big enough, I think, to demonstrate this. But we will be following people for longer, and if there is a long-term increased risk, then it may take longer for this to be found.